named the show after my practice, which is also called The Path to Wellness in Northeast St. Petersburg, Florida. And decided I wanted to talk about some of the myths that surround how people in the US especially, or women especially in the US, look at hormones and talk about hormones and believe that things just come with hormones, like that certain things are going to be a given if you're a woman. And I call it a myth because it's not real. I mean, it's not true. These things don't have to be part of what goes on with a woman in her life, and especially through the menstrual times. But even beyond that, there are issues that don't have to be there. And quite often what happens is that, sister tells or asks mom sorry, I'm not speaking well today. Sister asks mom what is normal, and like if sister is having cramping, she asks mom, okay, is that normal? Should I be having this? Or bloating, or heavy flow, or all the other issues that come along with it, that are lumped into the word normal. And hormones affect not just women, obviously, but half of the population is also male. And hormones do affect men as well as women. Men have a different balance of the hormones, but basically all the same hormones. So men and women have the same hormonal basis for the physical or physiological behaviors of the different kinds of bodies. It's all based in the same set of hormones, just in different proportions. And just like a woman's hormones can get out of balance, out of proportion, a man's hormones can get out of proportion. So with men, rather than the menstrual signs I briefly mentioned, there's a lot more, and we'll get into a lot more. But with men, it can be things like erectile dysfunction. It can be issues of metabolic syndrome, diabetes, cholesterol, weight issues, temperament issues as well. A man can go from being too laid back male, and then for out of balance. So true hormonal balance for women means, and I'm talking menstrual years, obviously. True hormonal balance means no cramping, no bloating, no acne, good energy, a good weight relative to your BMI, an appropriate weight for your size, a lack of things like cellulitis, I guess it's called cellulitis, yeah. And a lack of hormonally related headaches, migraines. All of these things can be related to hormones being out of balance. And there's more. So if you're just accepting these as part of your lot in life, or your solution is to go to your gynae and get on the pill, you're not really dealing with balancing the hormones and getting your body working correctly. So the pill might work in some cases for that purpose. In a lot of cases, it's going to send things way out, and a lot of people have real trouble when they do get on the pill. So it depends exactly on your hormonal balance. And that's part of the difference in how I approach things in my practice, A Path to Wellness, in terms of addressing hormonal imbalances. My goal is not to overpower or take over your body. My goal is to work with your body, your normal production of hormones, and get you into the range of levels that are appropriate, that are optimal for your body to function in a true state of wellness. That can include setting you up so that you can have a child. You know, we've had a lot of couples coming in, and I say a lot, but we've had a lot of success. In fact, our success rate is somewhere in between 80 and 100% right now on people coming in and having a fertility issue and wanting to get pregnant and trying for years in a lot of cases, not getting anywhere because things are not in balance. So we work on these things together, and it's always a partnership between myself and really my team, including my assistant patient care advocate and myself, working with you. But you're a big part of that picture. So following through on the things that we talk about is obviously very important, because there's no use, seeing me for reasons that you're pursuing something better and then not following the plan that we come up with. And when people do follow the plan that we come up with, guess what? We have great results. And when I say success rate between 80 and 100%, that 80 has a lot to do with, not necessarily following the plan. I'm not saying that my plan is 100% perfect, but very, very good, very well tested, and customized to each individual. So whatever I'm coming up with for you is based on what's going on with you. It is not based on whatever off-the-shelf drug dosage there might be, and whatever off-the-shelf drug is the one that's being promoted most recently from a pharmaceutical rep. We're not going that route. We're going a different route. we're working on balancing your hormones. We're working on improving the way your body's functioning, creating a state of wellness, which is why my practice is called A Path to Wellness. The ultimate goal is to create a state of wellness. Okay, so in some cases, there may be other concerns. There may be some things out of kilter. There may be life experiences that have occurred that have messed some of these hormonal situations up. In other words, taking things out of balance. For example, somebody may have a drinking issue, too much alcohol affecting their liver. Well, the liver is involved in many, many functions, like about 1,000 different functions in your body. And some of those functions have to do with hormonal balancing. They have to do with creating the right proportion of the right hormones and then implementing those hormones at the right times and in the right balance. So these kinds of things are involved in the liver function. So if the liver's out, then we've got to work on the liver to help work on the hormones. All of these kinds of things. There may be many issues involved. There may have been some trauma, physical trauma, mental trauma. Maybe there's been some abusiveness in your life. Maybe there's been some problems with relationships. Maybe there's been stressful circumstances with your job. Maybe there's been stressful circumstances with your relationship, etc. So all of these kinds of things affect hormonal balance. A lot of the hormones produced in your body are not produced where you might think entirely. Like, for example, yes, a lot of the hormones are created for a woman in the ovaries. But some of the same hormones are produced in the adrenal glands. Some of them are even produced in the brain. So they're all over the place, in terms of where they're coming from. And proportions will be upset if those hormonal balances aren't correct. And if those parts of the body are not functioning correctly. So all of these things can affect your hormonal balance. Okay. So given these situations, there's a lot to look at. And this is the benefit and the value in holistic medicine. Because when I'm looking at what's going on with you, I'm not just looking at, are your ovaries functioning correctly? Are you producing, do you have premature ovarian failure, as it's called, right? I think that's just kind of a lumped syndrome that ties a bunch of possibilities together and then says it's just that. There are ways of looking at everything going on with an individual and understanding how all of these variables interrelate and figuring out through those clues or those indicators where the core problems are, what the root cause is, what the underlying factors are that are involved that are affecting the balance and leading to the issues I've mentioned. So let's delve into some more issues. Okay, so sticking with women for now. Obviously, that's the largest, most affected group is women in terms of hormones, but men are affected as well. So if you have a history of fibrocystic breasts, uterine fibroids, ovarian cysts, endometriosis, breast cancer, memory loss, migraines, we can go on. Many issues, hair loss, nails that are brittle, dry skin, palpitations or fluttering in your chest, tachycardia. All of these things are hormonally related. Notice that none of those came from the original list that I started with. So we've got a whole new realm there. So there are many, many issues that are affected by and affect hormonal balance, creating an imbalance in a lot of cases. All of these can be tied together and understood from a perspective of hormonal balance. Other things that affect your hormones: your gut. Do you have adequate bacteria? Do you have the right strains of bacteria in your gut? Do you have candida? You know, are you consuming too many sugars or sweets, or too many baked goods, or too many starches? All of these things can affect your gut. Are you consuming meats that are full of antibiotics? That's going to affect your gut tremendously. Have you had a history of taking antibiotics? Again, affecting your gut tremendously. Why is that important? Well, many, many issues are related to your gut health. And I don't entirely believe that, as some do, that the gut is the root of everything, of all disease. No. But I do see a strong correlation with it. Your gut health is very important. The generation of certain vitamins like B12 is very dependent on your gut health. Hormonal levels, for example, neurotransmitters, serotonin. The majority of serotonin in your body is not in your brain. It's in your gut. It's produced in your gut. So if your gut health is not good, that's going to be affecting possibly your mental health. It might affect your moods. So, as we know, moods are a part of dealing with hormones, right? Women know this very intimately. And sometimes their guy friends or husbands, or etc., will be tuned into that to know when to be a little cautious about the approach, things like that. So there are a lot of factors, as you can see, there are a lot of factors that are involved in how healthy a woman's hormonal balance is, how optimal that balance is. Is it balanced? Or is it out of balance by a margin that causes a lot of issues, be they emotional, physical, even, specifically issues like depression, anxiety, anger, irritability, even things like grief can be stirred up, teariness, responses of that sort. These can be related to adrenal function, fight or flight, can be related to emotional issues that have been dealt with in terms of conflicts, in terms of stressors in one's life. So all of these things, it's very complex, obviously. There's so many issues that are related to hormonal balance. One of the ways in which I help women prevent miscarriage is by working on that connection between emotional health and physical health. For those who may still be of the mind that's a little skeptical about the connection, there's very simple examples. We can go back to Pavlov's dogs. You've got the salivating on the appearance of what they perceive as food, and then that classical conditioning where they're matched up with some stimulus like a bell or a light or some other sound or some other feeling even can be associated with that. So we have all of these kinds of little mini programs going on in our heads, even physiologically. We have memory in our cells at that level. So we have so many stimuli and so many influences that can alter or affect how we respond hormonally. So you can see the depth that all of this goes to. And it may seem like a daunting task to take on all of this and all of these issues and how they all relate to hormonal balance. And yes, it is, to a certain extent. But that's part of what I do. That's part of my job. That's part of, and it is, in a way, to a certain extent, I suppose I'm kind of unique in this area, where my practice focuses on truly looking at the underlying cause and looking at all of the factors as much as possible that may be related to what is going on hormonally. And so my intakes tend to be pretty extensive. They tend to be involved and get fairly deep. And I may ask all sorts of questions, everything from physical questions that may seem personal to, experiences psychologically, emotional environment, physical environment in terms of, what toxins one might be exposed to. All of those affect hormones too, by the way. So much so. Xenoestrogens, bisphenols, BPA, these kinds of exposures, even exhaust from cars, even exhaust from power plants, the mercury being generated, the additives in foods, the additives that are used in the process of baking, the use of fluorides and chlorines in the water, on and on. Makeup, many types of makeup from many forms with many types of chemicals in them that affect hormonal balance. Xenoestrogens being very prominent in the effect. And these include things like, as I mentioned, mercury, but in terms of makeup, parabens, sodium lauryl sulfates, polyethylene glycol, just quite a range of the components within makeup that are absorbed through the largest organ in your body, your skin, into the rest of your body, which means that they get into the bloodstream, altering your hormonal balance. Then if you're adding to that load consumption of foods that are full of hormones, like genetically modified bovine growth hormone in milk, in various forms of dairy, in beef, X-rays, CTs, PET scans. It's like a reflex, and it's not harmless. We can add mammograms to the list. There's so many. So as we go through all of these influences, as we're exposed to all of these influences, they have an effect on our bodies. So this is a good example, when we talk about all of the imaging that is used, all of the imaging that includes primarily X-rays as the medium. It's a truism that the act of measuring affects that which is being measured. And the more we do it, the more that effect accumulates. So as you can see, I've gone through quite a list of factors that are involved in affecting hormonal balance. So we're talking makeup, the food you eat, the toxins you're exposed to in your environment, medical radiation, just so many things within that realm. All of those factors at a deep level. And these things have to be kind of ferreted out and isolated and removed to really clear house, to improve the situation overall, and to give somebody a true potential for long-term wellness and balance. Okay, so when it comes to men, these things are true as well. Okay, so there is this kind of tendency in this country to have this sort of machoism attached to beef, right? The beef industry and, real food. That's real food, right? A plant grazing animal that is gentle and kind is your food, for starters. Then we inject them with hormones and antibiotics, including bovine growth hormone. Literally beef them up with other toxic chemicals before they go to market. We scare everything out of them when it comes to the slaughterhouse. Their emotions are cranking like crazy. Their catecholamines coming from their adrenal glands. All of those hormones, the adrenal hormones, are being secreted throughout their bodies, getting into all of the tissue in their bodies, meaning that what ends up on the plate is full of adrenal hormones, bovine growth hormone, antibiotics, other toxic chemicals, including pesticides from the feed they may be eating from, right? Or the ground they may be eating from, or whatever their feed might be, which can vary quite a bit. And there has been, a lot in the past in the news on some of the things that cows are fed on occasion that can lead to problems health-wise, both for cows and human beings. The same can be said for pigs, chickens, turkeys. They're not generally raised in humane conditions. They're not generally kept in an organic environment. They're fed foods that may be toxic themselves. Often the grain, part of the use of the grain industry, part of the volume of the grain that's produced, has to do with feeding these animals that then end up as the meal. And those foods quite often are genetically modified. And some experiments have shown cancer involved in the consumption of genetic modified foods. But the consumption of these foods is not natural to these animals. Unless they are free range, organic, raised in a natural environment, we're going to have some issues with what's being consumed and the effect of that consumption on the health of human beings. And of course, there's an industry wrapped around this we call the fast food industry. And the food sources in the fast food industry are not organic generally, are quite often genetically modified, are using additives and preservatives the majority of the time. And to add to that, we'll have other substances involved, like trans fats. They may be deep fried in vegetable oils that, through the application of heat, change geometrically and become trans fat. These are often carcinogenic compounds. In other words, can cause cancer. They can affect hormones, change the hormonal balance. And part of that hormonal balance is tied into cholesterol, because our hormones are rooted in the production of cholesterol, cholesterol, as in steroids, cholesterol. So we have the production of these hormones somewhat related to the balance of our bodily cholesterol levels. And so this also can affect our hormones and our hormonal balance. Now, there is some proportion of consumption that affects cholesterol levels. This is an area of a lot of debate. There's research that backs up consumption affecting cholesterol levels. There's research that shows that it's not tied directly to consumption choices. There are other factors that are possibly more important, such as even consumption of carbohydrates. Especially certain kinds of carbohydrates. But it's certainly important to know what that balance is from the point of view of heart health. It's one of the factors that helps us determine whether the environment you've created in your body is healthy for your heart. But tying it all back to hormones, cholesterol affects your hormones. And a related vitamin, which is also considered a hormone, vitamin D, is directly affected by cholesterol levels, because in your body, you make it, your body makes vitamin D using, as part of that source material to create the vitamin, quote unquote, cholesterol. So as you can see, vitamin D is a hormonally related vitamin that essentially is hormonal itself and relates to the creation of cholesterol. Then vitamin D affects our absorption of certain hormones like thyroid hormone. Vitamin D affects bones and joints, calcium metabolism, also related to the calcitonin in the thyroid, or the calcium production through the parathyroid, the effect of the parathyroid hormones. So all of these are tied to hormones. We have so much involved. And to truly be balanced, all of these factors need to be efficiently in operation. So when somebody says to you it's normal to experience various kinds of issues that seem a little out, maybe you should pay attention to the fact that it appears to be unwell or not optimal, as opposed to that word normal that really relates more to a bell curve and falling somewhere on that bell curve, more so than it does wellness and optimal health. We've got to get away from this whole sick care situation where we're looking for somebody to be sick and something that illustrates them being sick before we address it. Get more into helping people be well and preventative medicine, helping to boost the immune system so they don't get cancer or autoimmune issues, as opposed to, and I mean that preventatively, I'm not saying for treatment of autoimmune issues, but preventative medicine can be used to help to improve the state of wellness. Natural treatments can be used to production of testosterone because there's plenty there that's been put in place that's not being produced by the body, but it's still seen there. So it's the response of the hypothalamus is to tone back on the production of testosterone, or can be. So the same is true for all hormones, and this can be problematic in terms of balancing the hormones. So my preference is to focus on the underlying causes of imbalance and to work on those root causes, and help to give the body what it needs to bring it back into balance. And as we've discussed, there are many, many parts to this picture. From gut health to cholesterol levels to outside toxic elements that can affect the hormone levels, like xenoestrogens, the plastic bottles melting into your water if you're leaving them in a hot car, to mercury exposure. with this change in hormonal balance. There may be pain. There may be hot flashes, night sweats. Depression sometimes comes along with this. So these kinds of issues, again, I don't believe should be seen as normal, and I disagree. And I look more for optimal function anyway. So women don't have to, and there are a lot of menopausal women who don't go through significant night sweats and hot flashes and all of these issues. Some do. Many do. But it's because things are not in balance. Can that be improved naturally? Yes. We have many sources of production or affecting the production of estrogen, progesterone, and testosterone. You know, testosterone is an anabolic steroid. We don't need to use that. There are natural substances that can help one create naturally within the body levels that are more appropriate. So hopefully I've helped to clarify some of the issues related to what I consider the myths associated with hormones. And we can see that there's a possibility for wellness, a possibility for a life that's not fettered by all of these issues. That doesn't mean you have to have pain, or you have to have discomfort, or you have to have all of these kinds of issues during the time, whatever phase you may be in life. These are not requirements. If you're experiencing these kinds of issues, any of these issues, they can be addressed. They can be improved, and life can be a lot more fun. And we can do it very naturally. So thank you for listening. This is Dr. Christopher Jackson, PhD, DOM, Florida. My practice is A Path to Wellness, and you can reach us via the web at aptw.net, short for A Path to Wellness. You can reach us also in Northeast St. Petersburg, Florida, at 727-329-9637. And you can listen to us again next week, same time, on rhinoisland.com, WSPF-DB.com. We'll talk to you next time.